I'm Dr. Vinod Puri, Professor and Chief Neurology at National Heart Institute, East Sacral, Delhi. Today we shall be talking a little bit on Parkinsonism. Parkinsonism, as you know, is a degenerative disorder affecting the elderly population, particularly after 60 years, but it can also occur in younger people as well. 20 onward can also occur. It's primarily a disease where some neurons go for degeneration, and those neurons are particularly responsible for the development of dopamine. Once degeneration occurs, it means dopamine level must have gone down, and that's precisely what happens in disease, and it manifests by certain problems. Mostly all the problems, they have the motor disability. These people, they have tremors, they have slowness of movements, and they have some rigidity. Three cardinal features to occur in these people. Now, there are certain variations are there. Some people have all the symptoms, some people have more tremor manifestation, and the progression also does not follow a rule. It also takes time and varies from person to person, and disability also varies from person to person. We used to classify into different categories there, which are not much used as a clinical practice concerned, but they're more useful as far as the research purposes are concerned. When you want to analyze the data, then certain scalings are important, classify in different stages there. Parkinsonism has two types of manifestations, certain motor manifestation and non-motor manifestation. Motor manifestation, I told you, they have tremors, rigidity, and slowness of movements. These are important problems occur. Non-motor manifestation, they have depression, mood problems here, cognition problems, autonomy problems which manifest BP fluctuations, gait, the fall gaits, and constipation and sexual disturbances. These are quite important features, and this may be disabling features as far as the patient problems are concerned. Now, as for the management part is concerned, we have two types of management. One is supportive treatment, and second medical management. As a medical management, where different drugs are available on movement, the primary, I told that dopa is getting depleted, where certain dopa enhancing drugs are there. Dopaminergic drugs, where L-dopa, there are certain drugs, carbidopa combination that's most commonly used. The problem with the medical management is very good in the initial part. After 4 to 5 years of L-dopa preparation, people start having some phenomena. These are the dyskinesia, the intolerance to dopamine start developing, L-dopa start developing there. They have different features developing there. Most of the time, these are manageable because of the adjustment of medications. Once they go, they're non-manageable, then other features, the dyskinesia start developing there. And those are people who require the surgical management or require a deep brain stimulation there. You see, as the surgical management part is concerned, it is not now much used now. It's mostly replaced by the deep brain stimulation. The benefit of deep brain stimulation is that once you switch off the machine, then it's reversible. And with the use of the DBS at that time, it seems to get controlled. Now, it's not that all patients should go for DBS. The important thing is the person should be levodopa responsive. Initially, initial response is very important, and after that, if L-dopa is not effective there, some people start dyskinesia, which are not manageable without intervention part medical management, and they are also indication for DBS there. Some people who get lot of dyskinesia, other problems start developing after the L-dopa preparation, and they are the other one which can put for DBS therapy. Yeah. As I told you, surgical part almost not much used in the management of Parkinsonism and replaced by the DBS. DBS is a very good device and slightly expensive in the beginning, but overall if you look at, it's not that expensive, and taking the quality of life in consideration, and more people who are DBS, they are not able to manage their daily activity because of the disability, because of Parkinsonism, and this is the one where they want to go for DBS. They do help and helps better. Now, after DBS, what happens to medication part? Initial part, some people are on some small dose of medication, and later on it can also be tapered off. But such other features like non-motor manifestation, they are well managed with the DBS therapy there. That's all as far as Parkinson. Thank you.